Let's get oral. Hello, everybody. It's Camille and Jonathan at Let's Get Oral.
Howdy.
Today, it's my pleasure to introduce Dr. Liviu Steier. He has such an extensive background. I'm so grateful that he is letting us talk his ear off today, or letting us be privy to some of his findings over the years, because he has been a clinician for over 40 years, stemming from Germany, but he's also worked in the United States, where he resides today, as well as Brazil and Europe. He has done tons of clinical coursework. He serves as a clinical course director at Warwick University. He's a member of the faculty at the Royal Surgeons of Edinburgh. I mean, his list goes on, but I'll say this. He has done such extensive work in cariology and fluorescence. He has cultivated an incredible innovation pipeline that I think that we'll all benefit from. So I'm excited to kind of dig into his history of research, kind of his passion for the business, and what we've all learned through his technology and insights, so that we can get a better understanding of where treatment is going in oral health. So please welcome Dr. Steier. Thank you. Thank you for being here. Hi, how are you?
Hello, thank you. Thank you very much. I'm highly honored and delighted to be here. Thank you very much for the invitation.
I appreciate you being here so much. I first kind of want to give a lay of the land. You've been in clinical research for so long. What was your initial foray into the business? What did that look like for you? How did you get started in dentistry?
Well, when I reached the point for my grad education, I wanted to go and learn business. I was really accepted in one of the best schools in Germany, but my father came to me and told me, Liviu, you have only a reduced number of options. You can either become a teacher, whatever, or a healthcare professional. This is the way we do it. So, yes, here I am. Then I decided I was not in favor of medicine because I love working with my fingers. And the combination of tactile, visual senses is basically what drove me to dentistry.
Oh, that's fascinating. I can relate to that on a lot of levels. I very much need a tactile experience myself. That's fascinating.
Agreed.
So you really showed your father, because you've really cultivated a business out of dentistry. So how did you start in the clinic, and where were you able to kind of push out of that limited clinician view?
Okay. This question also, or the answer to this question will mirror my vision. First year dental school, I met my actual wife. We married then. We are still, thanks God, a couple. And one day, we were confronted with a very important issue in in the healthcare of our very close family. And I could not understand the argumentation for an amputation without visual diagnosis.
Interesting.
Believe it or not, it gave me such a hard time. That was the moment when I started moving outside the box and swimming against the flow.
Excellent. This is one of my favorite topics, is really pushing against the grain of the norm, or what we've just routinely done without questioning. So, in dentistry, what does that look like for you, and how have you found your way kind of pushing against the norm?
I would say thank you, G.V. Black, rest in peace. But we are driven by other criteria than just by the hard tissue or the hard tissue in the tooth, and to feel it, to touch it, and to check if we are already back in hard tissue. I don't know about you. I can tell you about my history. I was not in love with microbiology when
Oh, you're killing me. Okay, go on.
but as I said, when I had this happening in the family, in the close family, I understood that it is all about life. And it is not about tactile control. So, yes, Andre Lucy, I'm sure this rings a bell. He is so-called the father of diagnodents, of fluorescence diagnosis. So we started very early going into that direction. I have to mention Tankade at ACTA and the QLF. I was very, very early days, visited him and had the opportunity to see prototypes. I loved very early the idea of application of disinfection. Believe it or not, ozone was one of my great love, and I still am there. I still cannot understand how it got this disconsideration, professional disconsideration, of course, at any level. I don't know if you are familiar with the book Ozone, the Revolution in Dentistry of Professor Ed Lynch. Well, I had 2 chapters there, one in cardiology and one in endo, of course. We worked on that. I was grateful to Cavo for having produced this fantastic technology. And yes, the success were there, but I needed to see what I have to see. And we all are today shouting so loud for digital dentistry. We do not understand what it is.
Yes.
Um,
Well, if I could hold you there and summarize. So, broadly and simply, what I think you're saying is that in dentistry, we're using typically very subjective measures to get at the heart of a problem that could perhaps be visualized and addressed as needed.
I believe that, we were given 5 senses. Okay. There must have been a reason we were given 5 senses. If we do not look back and understand that the combination of these 5 senses should be used, then I am afraid to say we fail. And today, I have tears in my eyes when I say this, but we are lacking adequate diagnosis, adequate treatment guidance, and most important in all is we have to understand that we do not understand if treatment goal is or is not achieved with our treatment. So it is a fatalistic situation, and this does not belong into medicine, into dentistry. And we are honored to be allowed by our patients to touch them and to help them, to be asked for help. And as such, we owe something, and not only to our pockets.
Well, you've certainly done a lot to innovate in this area. So you mentioned ozone. Ozone kind of came off the table as a really innovative way to approach antimicrobial therapy in a healthy way. I mean, I'm going to put that caveat in there, in a healthy way, because it's more about balance. And we could theorize on what kind of conspiracy theories led to what is now kind of an alternative medical intervention using ozone therapy. But I think that it is more ubiquitous now, thankfully, in the dental arena than it was just, say, 5 years ago. So I'm happy to see the rise. But as you say, diagnosis is key. And some of your work utilizing fluorescence allows you to see, as a dentist, behind the chair as a clinician, what is an active lesion and what is an inactive lesion. And I think, fleshing out the difference there and in how you move forward with treatment is a great discussion point. But moreover, how do you see your technology being deployed both behind the chair and in the consumer's hands? Do you ever see a point where the consumer can do preventative at home? Yeah, you do. Excellent. I see you nodding. Tell me more.
Um, Allow me to open a parenthesis, please. Maybe allow me first to explain what fluorescence is.
Please.
I hope we all love flowers. We all love
Yes.
plants.
Yes.
We enjoy the colors. We understand the light, that sun is needed to develop all this beauty. So the sun will excite something in the flower, and the flower will give back. Fluorescence is part of the light, which will excite some excitable substitutes, which then will give back a picture. As simple as that. Meaning, you are using what you daily use. You use your light curing device. Well, you may know that we have different wavelengths for that. We are not using the 460, we are using 405 nanometers. And we excite what? Guess what? The bacteria, the pathogenic bacteria, which generates decay and perio disease, or even candida, okay, let's stop here. This will be excited and it will emit light in a different wavelength. Now, if you add to your loops which you use a certain filter, then the blue light which will excite the bacteria will allow you, coming back to your glasses and magnification, to clearly differentiate and identify, oh, we have here the presence of what? Of either caries or perio or peri-implantitis or candida generating bacteria. Okay? Now, you not only see them, you understand that once you do not see them, you got rid of them. As simple as that.
So I'm going to stop there and say so what you're saying is you can use the fluorescence that you've positioned in your technology to see both the types of bacteria that are associated with caries or cavities, and also the types of bacteria that are associated with periodontal disease.
Yes.
When you're looking at, I'm assuming, if you're looking at an inactive carious region, so that's a cavity that's formed that is no longer active, you're not going to see these bacterial present,
No.
correct? Excellent.
You will see the discoloration, and I'm very sorry, madam, to have to open again a parenthesis. What we are lacking in education, okay? I hope you enjoy cooking.
I do.
when you cook something, let's presume you are trying to cook some older bananas, you will see that when you put them on the fire, they will turn brown.
Yes.
This is due to the so-called Maillard reaction. The Maillard reaction is sadly not taught in grad school, okay? But it works in our teeth as well. So the dentin will change in combination with the sugar, its color. Again, GV Black, please rest in peace. The color is not a criteria for our tooth structure removal.
So, what you're saying is we perhaps have been removing areas that were unnecessary to remove.
I am delighted by this statement. You exactly are using my words. Thank you.
Excellent.
We are invasive. Drill
Yes.
and fill, forget about it. Please rest in peace.
Yes.
We are humans. And again, please do not forget, we have the privilege to be allowed to help other humans. If they are good, we are good.
So, as a dentist, I can now use this technology to identify active regions of problems, whether they be periodontal related, that is the soft tissue, or the hard tissue in that carious region. I would love to see pictures. I when I was looking through your all your beautiful pictures of fluorescence and your research, I mostly was concentrating on the carious regions, but do you see these deep pockets in periodontal disease just lighting up with that red fluorescence?
I will take a couple of steps back. Sorry for that.
No, please do.
Presuming we do a cleaning, we are scratching tooth structure off, but we don't know when we are done. Using fluorescence enhanced diagnosis, this is the term I have given to it. So fluorescence enhanced therapy and diagnosis. Fluorescence enhanced diagnosis. Using fluorescence enhanced diagnosis, we see what we do, we understand when we have to stop, when we are done, and we do not destroy. It can be used in cardiology, in perio. No implantologist
Yes, yes,
should place an implant in a mouth before he looked up if the mouth is clean.
yes.
Okay? No big surgery is performed without having hands washed, disinfected. Same with the eyes. You have to look into the mouth and make sure it's not only about the celebration of the implant insertion and the sorry 7 years later for the peri-implantitis, it is about giving the patient something he can trust. And let me take you one more step. Excuse
Yes.
me.
No, please.
I don't know if you're doing endo.
I mean, I'm always excited to talk about endo
Okay.
because I think there's a lot of excitement around where we hold the line on root canal, saving the tooth, extracting the
I
tooth. Go
would
on.
let me bring in. So in endo, the orgasm is the white line on the X-ray. Sorry for my vocabulary,
Go on.
but the truth is, we then hope that we manage to disinfect using fluorescence at the end of the root canal of the chemical disinfection. We simply dive a paper point in the canal, we take it out, we dive it into a dye, we look through fluorescence, point of care, and we understand success or we have to continue. No antibiotic prescription needed.
Wow.
And this leads me to a point. You understand now that I have written long letters to Dr. Fauci and to all healthcare ministers in the European Union in the adequate language. I speak 6 languages.
Amazing.
And I have suggested that in the ICU, before you start putting the ventilator in, someone looks using fluorescence into the mouth of the patient and understand there is infection, yes or no. Either we put daylight ventilators in the mouth or blue light ventilators, which will disinfect. We could have saved 40% of the deaths in the ICUs in the pandemic.
Incredible. Yeah.
No journal accepted. The Lancet returned my paper within 3 hours.
Wow.
3 hours, yes. And we managed only to publish an editorial on that, which is now in place.
I saw that. Incredible.
So you understand my frustration.
I do.
Noted.
I do.
Mm-hmm.
I mean, yes, there's. I mean, I don't see you proposing an outlandish, expensive solution to a very basic problem that we could get ahead of.
It's cheaper than the scanner everyone is buying for his practice and the CBCTs. I don't know if you are familiar, but those big AI companies just raised millions and millions of dollars to expand AI in X-ray radiology.
Of course.
I'm sorry. When you have to decide and to look up a decay on the X-ray, you already see a destroyed tooth using fluorescence.
Yes.
You are a couple of steps before, and you don't have to expect a destroyed tooth. You can still save a just involved situation.
Yes.
We completely ignore this. It's painful.
I also like your solution for evaluating the periimplantitis, or even just a hygienist cleaning an
Yes.
implant, because I think that probably not enough of them understand the fragility of the situation, and that they could be, with just their simple tools and evaluation, be causing some harm that they don't mean to be doing. Yes. So there's a lot of room for this kind of visualization approach.
But
When you think of, yeah,
education, and the administration of education is close-minded. And yes, I am happy to mention this openly. I don't have a problem, okay, because someone has to show with the finger on the situation. And I am grateful for you to allow me to do this. Education has and is in heavy need to be adjusted and to change.
agreed. What do you think is the fear behind not teaching newer technologies like this?
Okay. I wouldn't even say it is a lack of willing. It is sadly a misunderstood and misappreciated situation. We still believe that what we have done has given results, and why should we change if we already have results?
So
Okay.
the incident of inflamed gum tissue across the globe at closing in on 90% is success?
When I spoke with I presented my technology Reveal. I presented Reveal to a very, very prestigious chief researcher. His words were, number one, so you have a solution and you are looking for a problem. And his second statement was, we have antibiotics and corticosteroids. Why should we be bothered about anything else? You can imagine my answer, so I will not repeat that here.
We can also just edit it out, though.
I mean, we can always repeat that we shouldn't be killing our bacteria or compromising our immune system.
You know, I do not, honestly speaking, understanding and visualizing, so fluorescence enhanced diagnosis will, and where is the World Health Organization and their shout for reducing antibiotic resistance? I do not see it in dentistry. So I don't understand all these purposes, let's go to implantology. So you are celebrating removing the so-called destroyed tooth and placing the implant in the same session. How do you know if the alveola is disinfected or not? How do you know you are placing your implant in a healthy surrounding? Are you concerned about that? And you are going to clean it every 3 months. You know that when you scratch your implant, you are also removing titanium oxide. And I don't know if you are familiar, but there are already scientific evidence that this is cancerogenic.
Well, and it gives a localized inflammatory process as well, just from
Yes. You don't need anything anymore. Okay, if you go further, fluorescence is not only for diagnosis. Fluorescence activated disinfection works fantastic. We published and researched that.
When you say disinfection, let's talk about that real quick. So, what wavelength is
Photoactivated
this at? I know people have been using blue light for disinfection for a long time, red light for regeneration. What else? Is there something that I'm leaving out?
Okay. I'm sorry. I'm opening a parenthesis again. You see, I do it very
Please do.
often. So please understand that, sadly, I did not reinvent the wheel, okay, with my technologies. But my technology today is not used by my colleagues, but it's used by neurosurgeons.
Why is that?
Yes. Because in tumor surgery, in cancer, one of the biggest problems when you have to remove the tumor is you do not see the margins. So using what the body generates in the hem process generation is called the protoporphyrin, and building this outside, it's the very same biologic product, but it's called 5-ALA protoporphyrin 9. You can administer that to the patient systemically 4 to 6 hours prior to surgery. And when the neurosurgeons open the brain, they see the glioma margins so perfect that Professor Stummer from the University of Münster in Germany even did pathology and said, you know what? We don't need pathology anymore.
Wow. That's incredible.
And this technology is published. And believe it or not, today it's not used only by neurosurgeons, so in the sky of the body, but it's used by a lot of surgeons, even to place and to visualize nerves, and so on and so on.
So the nerves light up with the same porphyrin.
No, you don't use protoporphyrin 9. You can use different other ways.
Got it.
For example, today we are using sodium fluorescein. I don't know if you are familiar with that. So when you go to your optometrist, he will clean your eyes with a solution first, and then he will, if you have lenses, he will try and fit the lenses and to see the fit of the lenses on your eyes using sodium fluorescein. It's a biologic FDA-approved solution. I used it for many, many years already. For example, in root canal, if you use it, you can identify and look when you search for the MB2. And we use sodium fluorescein, and like this, you are there, and so on and so on. You understand it is.
Yes.
And the science, I'm sorry, please understand, there are millions of papers published,
Yes.
hundreds of books published. It is just we are still acting according to a multiple choice question. We just tick the box. And we have to open our brain.
So, as a clinician in your mouth, I can if I choose to take up the technology. I can see the borders of potential issues, the carious lesions that are active, and the periodontal soft tissue degradation by the associated pathogens that are in the pocket, as well as periimplantitis.
And
As
sorry, you put the glasses on. You do not take them off the whole day.
yeah,
Okay, just you replace your magnification,
yes,
and you are using them: cardiology, perio, implantology, oral surgery, aesthetics. I'm sorry. How exactly are
yes.
you choosing the shades? And then the patient is coming back on Monday and he tells you, I went to this and it was this black light in the room and the new tools, it did shine black. Okay. So if you do not understand fluorescence in your resins and in your materials, forget about. How are you choosing it? Just by shading? Oh, I'm sorry, this is misunderstanding of the profession.
I can personally appreciate this.
Yeah. So everywhere you see, you put it on in the morning, you put them down in the evening. You said how the patient, well, very simple. You have to give the patient protection glasses. I never ever worked without having the patient a mirror in his hand to see what I'm doing. With the
Wow,
protection glass, the patient can see what you see almost, and then you don't have to tell him, listen, here is a decay. He will ask you, oh, doctor, what is this? Can you help me? And you don't have to do blah, blah.
amazing. That's incredible. I love that.
So communication is already the next step. And sorry, I know at the end of the day, you have to bring home something to pay the bills. I do not like to sell what I'm doing. It is something which sells by itself. And this is the way, the correct, fair, and ethical way to do it in collaboration with your patient. And this is shared decision making with your patient.
Yes, I see that. Do you see an at-home use for this?
Yes, there are different technologies available using fluorescence and protection glasses to identify your oral hygiene and so on and so on, and published already in different papers. And by the way, sorry to come one more thing, again, a parenthesis. Sorry,
Keep it coming.
dermatologist, you are going to a dermatologist and he's looking at your skin with his naked eyes. Don't trust him what he's saying. He does not see anything. But using
Amazing.
fluorescence, okay, number one, he sees infection. Number two, he sees disease. He can use different photosensitizers. Remember the plants and the chlorophyll, okay?
Yes.
You can see everything. How can I base a diagnosis and a treatment without adequate diagnosis? I'm sorry. You understand where I'm coming from. You understand the
I
pain
do.
which I had then and where it led me today.
I do. I love all of the applications. I know that when I have discussed fluorescence and different wavelengths, there have been some fears around induction of cancer, especially with the red light. What are your thoughts on that exactly?
Okay. We have a patent which with the company Designs for Vision again. Yes, we are using so-called low-level laser therapy. Okay. The idea is for photobiomodulation. Please understand, I hate to give an opinion. My way of giving an answer is based on available science. Otherwise, I would say I don't know. So, available science proves that the process of photobiomodulation is there, should be used as well in dentistry as in tumors, even in skin. If you look up as a lady, you probably are familiar with all those light therapy for your face and for your skin.
Yes.
Yes, there is a place for that. We understand, and if we have already our barriers and we have our clear path, which we have to follow. And if we follow, we are on the safe side. Blue light, again, if we talk blue light, we have to understand the wavelengths we are talking.
Yes.
Same with red light.
Yes.
We have to understand the purpose, what we want to do, and how we have to achieve. We have to understand the energy, the quantity of energy we are giving, the timing. So yes, photobiomodulation, big yes. Please look into it. It is worth looking into it.
So we do have devices for at-home use. So this is why I'm bringing it forward. You mentioned the light therapy for skin, and there has already been light therapy for teeth. But do you see utility in an at-home therapeutic for your gums?
Yes. For disinfection, yes. There are
Not
already
regeneration?
here science regarding the technology, the idea, yes. What we do not have enough, we do not have enough research, wavelengths, position of it, and so on and so on. Yes, the answer is yes. We are working with, as I said, we have this patent. Yes, this is already designed also for that. But general, over the counter, I would, at this stage, step back.
I see. Got it.
Okay.
But not necessarily for disinfection.
For disinfection, the statement is yes, to be used.
Okay. Yes. Excellent.
Okay.
I think
And
that as we move forward into periimplantitis epidemic land,
yes, yes.
we should want some at-home therapeutics that aren't antibiotics broad spectrum.
I would not say yes. I am well. My first contact. I don't know if you are familiar with the Misch Implant Institute. I graduated Carl Misch Implant Institute early in 1995. It was after I attended the ITI meeting number 2 in Basel in 1980 something, and so on, and being in touch with Brannemark and so on. I loved what I learned from Carl. I would not say to a patient, congratulations, you have your implant, now you are done. I would say, I do say to a patient, or I did say to a patient, as I'm now retired from clinics, I did say to a patient, you started a journey, and we can only together manage this journey. So, yes, well, I'm not an advocate of bleaching for scientific reasons. Misunderstand.
Why is that?
I would exclude this.
Why is that?
But the use of peroxide at 1.5% with blue light as an adjunct to oral hygiene at home, please use it. Please use it. Okay?
Okay.
So we published even a paper on research based in Brazil, and we proved that the use of 1.5% peroxide in combination with blue light is even better than the disinfection with chlorhexidine, and so on.
Wow. Are there other drug delivery opportunities with the fluorescence for the oral cavity?
Yes, there are many. There are many, even over-the-counter technologies available. I very much like the combination of this. Patients have access to these blue light toothbrushes.
Yes.
In combination with adequate peroxide. I would not use it for bleaching. I would use it for disinfection.
Got it.
Yes, you have a weapon in your hand.
Yeah. Yeah. What are the dangers of bleaching and whitening?
Science has proven that the high concentration of peroxide in combination with blue light harms the tooth structure.
The enamel specifically?
Yes.
Got it. Interesting. Do you feel differently than what's been proven?
No.
Or you stand by it? Okay.
No.
So one of the things that struck me is I'm not a cariologist. I have been mostly focused on the soft tissue in the oral cavity. When you talk about the bacterial microbiome or the carious legion infiltrating the enamel, I always thought of it as though the microbiome in that area was creating an acid environment that eroded the tooth. But the way that you have described it clinically makes me feel like there are embedded layers of bacteria, like they can soften the hard tissue in such a way that they actually migrate through the tissue itself. Is that true? You're nodding at me, yes.
Yes.
I had an underappreciation for the migration factor in a cavity. So when you're looking at this phenomenon with the fluorescence, what does that look like? Is it just this deep kind of color gradient that moves into that
Yes.
carious leaf? Okay.
Okay. Thank you very much for this very well formulated question. Yes, we do have to understand and to learn and to teach prior to putting fluorescence into the hands of our clinicians. Why?
Yes.
We have to differentiate different levels of fluorescence associated with different causes. And then we have to understand what is the purpose of what I mentioned as a treatment guidance and treatment goal achievement. Does it mean the complete fluorescence or what is emitted back as a fluorescence has always to be removed? No. Okay. So you need, you, my fellow colleague, okay, the one whom I dedicated my thinking and my efforts, I have to share with you the evidence and the science. So we understand what we are talking about and we understand what we are looking for and how we use it. And this, madam, is exactly what I was telling you. This has to be implemented into the first year dental school.
If I could just capture it briefly. So, with something like a carious lesion, where you have an active infection, you see the visual color, you're not necessarily, your goal isn't to take out every aspect of color necessarily.
Yes, madam, correct. Same in other places. And in addition, as I said, I love using photosensitizers. Okay. So there is a combination. Okay. I have to understand what am I looking for, what addition sensitizers. And I know many of the listeners will say, oh, but this will delay our time. This is time consuming. And so, no, completely wrong. It
I feel
puts
like it
you
would
in a,
shorten the time.
it will shorten your time. It will raise your success rate. And it will what? It will raise the trust and the relation between your patient and yourself.
Indeed.
You know, you don't need anymore the Google reviews. You know, the patient, when he stands up, he already understood that the treatment was completed.
Right.
And the goal was fulfilled. I don't know. You can you feel it's something to be felt, you know?
Yes.
Yeah. And remember where I'm coming from.
It takes the art of the consultation away. You are basically allowing them to visualize what is happening, and And it's easy to get on the same page once everything is
Yeah,
understood.
and you don't need the blah blah. By the way, yeah, and
Yes.
by the way, you know that the technology is used today in wound care.
Yes, I do.
Okay. Yes. So if I say wound care, you understand already where I'm coming from. Yes. So if it's not this, forget about whatever we do.
Right. I think I'm going to leave it there because basically what you're saying, Dr. Steier, is that we have all the tools to be effective, much
Yes.
more effective than we currently are. And it's such basic principles that we are using it in all other facets of medical intervention with basic wound care included. And yet, this basic wound that we're trying to heal in our mouths is still somehow eluding us, yet we have the technology right here.
Yes, madam.
Yeah,
Yes.
I can understand your frustration.
And I have tears in my eyes.
I really appreciate your time today. This is incredible. I think that everybody could have a listen to this and maybe rethink how they're deploying technology right now, because it would be a simple purchase, just upgrading the loops in the practice.
Yes.
Incredible.
Yes.
Thank you for your time. This is
It's
if
it's an honor. It's an honor, and I'm delighted, and I thank you for giving me the opportunity to share my thoughts.
I really appreciate your openness and candidness. If you could leave us with some thoughts on or your preferences for how you spend your retirement. I want to know what you've done now that you are not in the clinic. What kinds of things capture your attention now that you're not pressed to be frustrated at this lack of innovation in dentistry now that you're sitting at home, hopefully having a little bit of time for reflection? What are you doing there?
Um, Thank you for this question. I have my grandchildren,
Yes.
and I am delighted and honored to have them. And I think that what I'm doing now, critical thinking and decision making, is not something which is really taught again in medical and dental education.
It's true.
We are taking decisions every moment, but we do not understand the protocol of critical thinking, analytic hierarchy of priorities, weighting the weight of the criteria and the decision making. We are all diving very deep in this digital area, from smartphones to everything else, but we do not understand that an algorithm has to be built upon a scientific, critical thinking and valuable arguments leading to what we have. And this is exactly what I try to do. I'm very deep into this, and I'm diving deeper and deeper, even trying to learn about AI.
Excellent.
And this is basically my major point. Yes.
Are you doing any education currently for others?
Yes. Yes, I'm doing. I am delighted and honored to be allowed to give a full day course on the 14th of September here in Boston at Tufts
Oh, very nice.
University. I will be given several other lectures. I will give an online education with Buffalo University. Then in December, an international FDI lecture. Yes.
Excellent. I'm so glad that you're still active, and maybe you can have some paired critical thinking skills courses to go along with that, because I think that is a deficiency. I think, I went through my PhD program, and I taught dental students and some pre-meds, of course, but there was always a kind of joke around the PhD MD, the person who goes through that critical thinking PhD program and then goes through the MD program. So MD or the dental degree, you're really forced to make a decision, really understand what those decision protocols are, we'll say. In the PhD, you're challenging your own thinking. You're saying, I think this is what's happening. I'm going to try to prove myself wrong, which is a very different way to go about it. And so when we talk about MD PhDs, a lot of times there's this assumption that the MD is compromised because they're going to second guess their approach to the medical care. And I think this is a wild accusation, but I can appreciate the nuance in that statement. But I definitely think that we should all be questioning how exactly we give medical care and some of the nuance behind the person, because there are so many things that we're learning real time in science that have disrupted what we think we knew just a year or two ago. So I think one of my driving passions is getting the information to the people so that we're all making collectively much better decisions. And that's why I'm here today. So
yes, I agree.
I really appreciate all of your contribution here. And I hope that your foray into AI helps you develop even more innovation, because I think that you could definitely couple the two.
Thank you very much.
All right, I'm going to say goodbye, and it was lovely.
Thank you.
Thank you.
Dr. Steier, thank you for your time.
Thank you very much. And thank you again. And my very best wishes to everyone listening.
Thank you.
Of course. Have a good one.